Now we'll talk about the thing that everybody loves to talk about, that's supplements. And I'm just going to go through, almost in no particular order, evidence-based, usually meta-analysis, randomized control trial on humans, no rats, no mice, no petri dish studies, no theory, okay? I left that stuff out. There's a bunch of theoretical stuff, which I'm not even going to tell you what they are because, resveratrol, theoretical. Astaxanthin, theoretical. Okay, but no, they're not in here because there's no good human trial. The first and foremost is vitamin E. Why? Conventional medicine says this. They said, you have fatty liver, give vitamin E. There's no drug protocol for this. Give vitamin E. That's what they say. So let's take a look at this. This is a meta-analysis, really. The general doses ranged from 400 to 1200 IUs a day. The study duration was from about anywhere between 94 weeks to more than 4 years, which is a ton. And here's an example. So here are the studies. Here's how long it was. Here's what the dosage was used, and here was the result. ALT went down or wasn't significant. Steatosis went down based on a couple of them. Inflammation went down or wasn't significant. That ballooning that I showed you earlier may have gone down. Fibrosis didn't really do so well, except for this one particular study. So based on that, would you give vitamin E? Yes. And what dose? I'm going to kind of leave that up to you, but I have some ideas.